And they have a court proceeding this morning at 9, but apparently, according to 502 live streamer John Cherry, our still streamer, he went down and talked to them and asked them why nothing was going on. And pretty much, they said that they had done a switch to virtual court because they did not want people gathering. So that's the reason why there's nothing being covered downtown. Crazy, huh? The speaker's on, you guys. Give it a little bit. A little bit of video space there.
Hi, good morning everybody and welcome back to LUVAX. Do an outstanding job accommodating the makeup appointments necessary to get caught up after the closures last week from the snowstorm. It's hard to believe that was all a week ago, but that's all we were talking about all the time. But here we are with different weather, so welcome to the Ohio Valley. This LUVAC site continues to be recognized as one of the most efficient operations in the whole country, so we're just really proud of our public health team and all the volunteers that have made that happen in our entire medical community. We're just doing wonderful work as a team here to fight this dastardly virus. This is a week of mixed feelings. As a nation, tragic milestone of 500,000 people, 500,000 people passed from COVID-19 this past week. And it's hard to put your head around that, especially when we think back about a year ago. You know, we were hearing about the virus, but little did we know how much tragedy it would leave in its wake. And the magnitude of these losses really is hard to process behind each and every one of them. Everybody knows somebody that's been affected by COVID right now. But just the emotion and the sadness is really, really tough. So it's why we want to keep doing our job. You can't get a vaccine, wear a mask, right? Everybody can wear a mask, and wear a mask even after you get the vaccine. So that's the sad part. As a community here too, we will be approaching, I'm sorry to say, 1,000 deaths in the next several weeks. So that's a bad milestone for us as well here. With that backdrop, of course, it's a really hopeful time. Vaccine supplies are in a very significant way, so there's lots of hope around that. There's lots of hope for a lot of parents too, and many students with yesterday JCPS passing their go back to school vote, the JCPS board, in a limited way, but a lot of people are very fired up about that. So that's another reason for hope. Cases are falling. We're glad to see that because for months they just kept going up, and now for over a month they've been going down in a very significant way. But we can't let our guard down, we can't let our mask down yet, because we got a long way to go. But we do have real reason for hope and optimism that the next 12 months are going to be very different, much brighter than the last 12 months. And obviously these life-saving vaccines are a big reason why. I do know that there are still some people in our community who still feel some hesitation about getting that vaccine. That's not so much of an issue right now when demand exceeds supply. But in probably 6 weeks or so, 6 to 8 weeks, supply is going to increase demand. So that's when we really have got to be already have addressed the people that are vaccine hesitant or vaccine skeptical. I want to make sure that everybody understands that this vaccine is safe. 70,000 people. More than 45 million people in our country alone have received the vaccine to date, and over 110,000 in our city. I've received it. You might have a little sore arm. Your legs might be a little shaky after the second dose, but it's nothing that an aspirin and a good night's sleep doesn't take care of for most people. And believe me, it's much better to have those symptoms than it is to get COVID. So by taking the vaccine and with all of us working together at LUVAX and throughout our hospital system and pharmacies and clinics, we're getting closer to herd immunity. That's really our goal here as a city and a state and as a country, because then maybe we'll be able to take our mask off and hug our friends and our parents and go to your favorite restaurant, go to the favorite concert, whatever it is, but people keep just wanting to say, man, it's going to be great when we can get back to normal. So this is a big part of making that happen. Now, another big step. Starting next week, March the 1st, we're going to open up appointments for vaccinations to people 60 and over. A lot of folks have been asking about that, so that's a big milestone. That beginning on Monday, individuals 60 and older can begin scheduling their appointments to get vaccinated through our various vaccine providers. So this is outstanding news for the community. We want to get as many shots and as many arms as quickly and efficiently as we can. Now, here to give us more information on the next stage of vaccinations, let's welcome our Associate Medical Director and Co-Chair of our Vaccine Distribution Task Force, Dr. Sarah Beth Hartledge. Dr. Hartledge.
Thank you, Mayor. As you mentioned, we've made tremendous progress toward vaccinating our community. Together, we have completed Phase 1A of healthcare workers and long-term care facilities and gone a long way toward completing Phase 1B, which includes first responders, educators, and all adults over the age of 70. The wait list for appointments for those over the age of 70 is nearing its completion, which is to say that everyone has been offered an appointment. I'm proud to say that we are now ready to make the next step and move into Phase 1C. This is potentially a very large group, measured in hundreds of thousands rather than 10. It is increasing, and we expect it to continue to do so. The vaccine remains a precious resource. The Vaccine Distribution Task Force has, in communication with our cohorts at the state level, decided to place an emphasis within Phase 1C on adults over the age of 60. This decision in no way is driven by the diminished contribution of our essential workforce or the very real need to vaccinate patients with underlying medical conditions. These groups are very important, and we will seek to include them as quickly as we can based on supply. But we know from of severe disease, hospitalization, and death occurs in the group of adults over the age of 60. We expect that placing this emphasis will save many lives. Beginning on Monday,
let them know we're coming back. Tell them we're coming back. We're coming back.
COVID vaccine with a local provider. Please remember that the schedule is and likely will remain very full. Your appointment may be may spend some time on waiting. Ask for your patience as
We've got a big group behind us here today, and they are members of our Vaccine Distribution Task Force. We started this year we wanted to bring all of the members of our community together, our scientific community, our business community, our healthcare community, so we could all figure out together how can we defeat this virus as quickly as possible. I can tell you the top 11 areas around the country are secret weapons.
Coming back.
Teamwork. outstanding group we have behind us here. Sometimes,
That's like we heard. Like we heard. You need to follow through.
Knowing that has really manifested itself in both our testing and our vaccine process as well. So we will do in a moment they're available to the media as well afterwards if y'all want to speak with any of them. Dr. John Klein is here. Dr. Klein, of course, is famous because he is the doctor.
I don't know if I'm welcome or not.
Let's hear it for Dr. John Klein. All right, I'll pay for that later. Okay, so LUVAX, outstanding partnership with the state and federal government, because remember, that's how we're getting the vaccine at the local level. And then we've got to work with our community partners, pharmacies, clinics, and local hospital systems to get this done. So we're working with them to set up multiple avenues for people over 60 to make their vaccination appointments. This has been a long-held desire to get people over 60. So we have 9 options for making an appointment. So to tell us more about how these will work and about their own vaccination efforts, I'm going to welcome several of our community partners that are members of our vaccine task force. So first up is Dr. Chuck Anderson, Vice President and Chief Medical Officer of Baptist Health. Chuck?
Thanks, everyone. Thanks for being here. Thanks for asking us. The other hospital systems in the city, we are opening up our website, scheduleyourvaccine.com next week on the 1st, also Monday, and we'll be expanding. Happy to announce that we'll be expanding next week as well. So that's our main effort right now is expanding from the website, getting more vaccines to get them into more arms. So thank you.
U of L Health, of course, is a really integral partner with these efforts. Dr. Jason Smith, our Chief Medical Officer, is with us here today, and he's been at the front of a lot of our conversations here on this virus for a long time. So, Dr. Jason Smith.
Thank you all. So U of L Health is going to continue our efforts as far as vaccination is concerned. We are going to start opening up the majority of our appointments on Thursday mornings for the new 60 and over group. We'll have them out by about 8 a.m. on Thursdays for the upcoming week, as well as continuing to have kind of a rolling appointments as things open up. We're going to continue to work with our church partnerships throughout the community to help bring some of the vaccine into the other areas and neighborhoods within the community. We will be at First Gethsemane Church this weekend. We're going to continue to work with Emmanuel Baptist Church, as well as many of the other churches moving forward in the upcoming weeks. That effort will continue. If you need to get into our appointments, we will have appointments at South. We're going to have appointments at our Brook and Liberty location, which is drive-through. We will also have appointments at Mary and Elizabeth. And if you're out in Shelby County, we'll have some at Shelbyville Hospital beginning next week. If you'd like to be one of our community partners, please, you can get on uoflhealth.org as well, and there will be a list and sign up to ask if you want to be part of our partnership to get out into the community from a church standpoint. And I want to thank all of those partners for letting us use some of their multi-use facilities to help set up some of our vaccine drives and vaccine events that we've been doing. It's been a great outreach for us, and it's been a lot of smiles and happiness throughout the
Thank you, Dr. Smith. And of course, he alluded to U of L Health going into the community. We're getting really outstanding results working with some of our community partners, and particularly some of our black churches. And we're just finding that we've got to reach out in many different ways. So where are people most comfortable receiving the vaccine? So the equitable distribution of this vaccine is really important to us. Black and brown communities have borne a disproportionate pain from healthcare in the past, so we're determined to make sure that they're getting vaccinated at proportionate levels. So going into the community right now is a big part of that. That's going to change a lot when supply comes on. It's going to not be that uncommon for that to be taking place, but I'm very appreciative of hospital systems for moving into the community and partnering with so many of our organizations. that as well, that effort, and of course vaccinating in all of their locations. So next I'd like to welcome Dr. Steve Hester, Chief Medical Officer of Norton Healthcare. Steve?
Thank you, Mayor. Really excited to be here today, especially considering Dr. Hartledge had mentioned that the 60-plus age group was certainly feeling the effects of this pandemic horribly for the past year. So it's great to move into this category. We'll be providing, we've been continuing to provide the vaccine to the community. We have 4 fixed locations spread across the community. As Dr. Smith had said, we're working with churches, going into the community and trying to have special events that allow us to definitely spread the access. And for those who are having more challenges getting the vaccine, bring it to them. Nationally, if you look, there's a lot of comment lately that their supply will continue to increase. While it's a little bit still restricted, we hope to see that increase in the upcoming months. What we'll be doing for scheduling is our public website, we're having a wait list. Basically having individuals go to that list and creating a queue. As individuals put their name on, send them back an individualized link that will allow them to schedule appointments. People are in the queue as they've gone through, so what that allows us to do is to continue to build that. We expect to be adding appointments over the next month, and then certainly as increased supply becomes available, we'll do the same. So really excited about this as well, working with LUVAX. As appointments at LUVAX become available and they have capacity, we'll also be sharing some of that list as we did with the 70 plus. So some patients who go onto that list may find themselves getting a link to come to LUVAX for that appointment. The goal is thanks for sharing the message and appreciate your help.
Okay, and our federally qualified healthcare centers, or FQHCs, are a big part of our vaccination efforts as well. So to speak on their behalf, Ann and then Bill Wagner are going to be coming up from our FQHCs in the community. Come on up.
Good morning and thank you, Mayor. With me this morning, I've asked Ian Hagan-Grigsby, who's the CEO of Hartwell Community Health Center, to join me. Currently, the federally qualified health centers in Louisville have 4 vaccination sites. Family health centers have 3 sites location. Hartwell is providing the vaccine at their main site on Wilson Avenue in the Hartwell neighborhood. Each year, our health centers provide care to about 10,000 persons that are age 60 and older, and the majority are racial. Live in medically underserved neighborhoods where the residents are most at risk for COVID transmissions and most at risk of dying. The primary goal is to ensure has indicated. Because at the present time, we will focus on serving our patients first in the regular health centers that they're familiar with, where they go for the regular medical care. We will not have online scheduling for the hospital system, but rather we will reach out to our patients to call them by telephone and help them schedule an appointment. If someone is a current patient of any of our health centers and they're 60 years older, they can also call their health center. We'll have appointment slots available. We also have partnerships with U of L Health and Norton Healthcare, soon to be with Baptist. We're appointments at their sites. So we're committed to making vaccine more accessible to everyone. Risk in our community, and as more vaccine becomes available, we will be opening up more of our sites to the general public. So thank you.
Okay. Bill is the co-chair of the Vaccine Distribution Task Force, and he's going to give a description of kind of what the task force does and how we're as we look down the road as well. Bill, you and the team are doing a great job. Thanks very much.
thanking all the members of the task force who working to bring vaccinations to the community. Basically, the task force is comprised of a combination of healthcare providers, many of whom you've heard of from today, to who are in a position to bring vaccines to the community, medical experts, science advisors, employer groups represented at the table because that's a really important partner in health centers and others. And basically, we meet every week and are going to bring vaccines to the community in an efficient way and in an equitable way. So we look at the data, we look at the supply coming from the state, and spend our time figuring out how we're going to efficiently bring vaccines to the community. So, we'll continue doing that. As the mayor said and others have indicated, we expect vaccine supply to increase in the coming weeks. So it's our job to make sure that we have the capacity to deliver whatever vaccines come our way. And that's the So we look forward to the supply increasing and focusing our efforts on
Bill, and we're also the communications subgroup as well, of course, is important all the time, but it's really important right now to make sure we're getting the right messages to groups that might be a little vaccine skeptical or vaccine hesitant, to make sure they get the information so when it's their turn to get the shot, they will feel comfortable about doing so. All right? So, I think my third final speaker, I think I've said I've had final speaker here twice, is Dr. Hartledge is going to come back to the podium and share some information about the new appointment system we have and the latest data on our vaccination totals here at LUVAX. Dr. Hartledge.
So LUVAX will be focusing on the 60-plus group along with our other providers. We will be offering appointments from off of Norton's waitlist along the 70-plus group and expect to continue that as well. I'm going to close by delivering our weekly data update. So for through close of business yesterday on Thursday, across the metro area, we have delivered a total of 167,973 COVID vaccines. That includes 110,700 and 57,091 boosters or second doses. 15% of our community dose and approximately 9% received both. Here at LUVAX, our total number is 40,911 with 27,849 primaries, 13,062 boosters. We also like to recognize our volunteers during this period every week. As 120 registered volunteers who have given a total of 39,590 hours on site. And I hope the volunteers behind me can hear me when I say that I think their labor is priceless, but there is a multiplier that is used for these things. And this week, the economic impact of our volunteer labor crossed and is now $1,076,848. As you know, after volunteers serve 40 hours on site with us, they become eligible for vaccination, and to date, we have vaccinated 523 of our volunteers. The week is a challenge every week because they are all fantastic, but I do have a few here with me today. First, I have Sobia Farouk, who's been here and been an extremely flexible volunteer who's worked in all three of our zones and been willing to take on any job that I have Allison Solon, who always signs up to work the first shift in the morning and then doesn't go home and stays here station where she's given us over 100 of her hours. Most of our volunteers are here to serve the public and to take care of patients, but it takes a very special volunteer to care for other volunteers. In the volunteer reception area are among our most popular folks, and representing them today I have Pedro Valente. I have two more who are not here with me today, but I'm going to share anyway. Megan Shelter and Laura Bone, whose supervisor in Zone 3 stated that they have, this is a direct quote, a high degree of dislike for cold weather, but a high degree of joy that makes it fun to work even when And then we also can't function without the service of a large number of Metro employees. We have about 40 on site with us here every day. Many of them are here on a rotational basis. They come and go, and this one is rotating back to her quote-unquote real job next week, so we'll be sad to see her. Tony Rice has helped us implement a number of new innovations here at LUVAX. Whenever anyone has had an idea, can we try something out on the floor, and Tony has been the person to track the metrics to see if it was actually a good idea or not. So thanks to Tony Rice for her service. And that's all I have for this week. Thank you.
Here and also call out our nurses that we celebrate every week. Eleanor Manson, the president of the Nurses Association, with you. Thank you for inspiring so much many of your team. They're always showing up and helping out here. And your colleague, Dr. Ruth Carrico over here, who's helping in so many ways as well. So let's give it up for our nurses and everything. With that, we're happy to take any questions. Yeah, so the question is, how many people do we estimate over 70 are remaining, and how will we take care of them? I don't know, Doc, if you have, they will always have priority as we get into the other phases.
They continue to be eligible. Everyone who was on the wait list has been offered an appointment. I'm not sure, a couple weeks out. We're scheduling a couple weeks out into the future, so they haven't gotten their vaccine yet, but they should at least be on a schedule somewhere if they have gotten on the list. But just because we're moving to 60 on Monday doesn't jump in there as well. Yeah, and they continue to have priority on the list, just the same way that we've held some amount for healthcare workers along the way. So the question is about the Janssen vaccine, which we expect to see approval from the FDA under EUA today. That, as you may know, is a single-shot vaccine. It also has much less stringent handling requirements. It's a lot less delicate than these mRNA vaccines. I'm excited to be able to hopefully deploy that into the community in, for example, transient housing, hopefully into our homeless communities, things like that. I expect to see the health department receive some of the Janssen vaccine, and that we will be deploying that into the community. Those conversations are ongoing to determine the quantity, but we expect to receive some hopefully before the end of March. So the question is about essential workers, and you're exactly right that it is a very large group. Sort of depends on how you define them and which way you slice it, but we have an employer subgroup on the vaccine distribution task force, and in communication with them as well as the task force at large. There will have to be some kind of organization to get through those people in an efficient manner. We look forward to partnering with some of our large employers to get their staffs vaccinated. Our organization will be. We estimate that there are at least 100,000 people in the 60-plus group, and so I would expect it would take us at least 5 to 6 weeks to move through that. Hopefully we can exceed that estimate. We've exceeded every other estimate so far in this project, but I think it would be able to.
I also want to recognize Dr. Sarah Moyer over here. Of course, she's the Director of the Public Health and Wellness Department and our Chief Health Strategist, so you all are very familiar with Dr. Moyer. Thank you. The landscape right now, as we've seen, is the tragic milestone of versus the hope of the vaccine, and then a lot more vaccine coming. And then a lot more vaccine that's going to be more flexible with its storage capacity, specifically the Janssen vaccine, and maybe some other progress as well. Steve, is that right? Do you want to comment on that?
Oh, sure. So I think one of the things the Mayor was referring to was it does look like the FDA did make some recommendations on changing the Pfizer storage recommendations, which were ultra cold freezers. It would allow it to be stored in normal freezers, which does allow some changes in terms of how you process that, as well as how you get it out in the community. So I think it may offer some opportunity for us. Certainly we're waiting on to see those full recommendations, but I think as a community it'll allow us to look at using some different sites, and certainly as we've been going into churches, potentially using that vaccine in those facilities as well.
Okay, everybody's available if you want to talk to them individually, but thank you all so much for coming out. We appreciate the coverage. Thank you. Have a great, safe weekend.
Good job, you guys. Thanks for sticking with me.